three summer remedies. If you are new to this, live, and you want to know what was covered in the last session, you can go back to the profile and find out about the last three remedies discussed, where I discussed about Kali bichromicum, antim crude, and sinapis nigra. And it was a very interesting learning how you should prescribe Kali bichromicum, when you should prescribe Kali bichromicum, what are the key indications, and some interesting rubrics from repertory and repertory, and some keynotes from Materia Medica. Same we did for antim crude, which is one of the most underrated remedies in summer season. We always think of ipecac or nux vomica, but this is one of the very interesting remedies which we should think. And third remedy which I discussed in the last session was sinapis nigra. You'll have many patients with allergic rhinitis or dry coryza who are unable to bring out the discharges or are having difficulty. You can go and check out the video and find out what needs to be done to understand those type of patients and when you should prescribe sinapis nigra. So today we'll discuss about the next three remedies, and the remedies that today we'll be discussing are sulfur, colocynth, and ipecac. So ipecac will be the first remedy which I will take over, and one of the interesting things about ipecac is that it is a very short acting remedy. Number one, in all the provings done by Hahnemann as well as the other provers and some toxicological findings, you see that it has a very short duration of action, very small symptoms which come and go quickly. Uh, Another thing which we see is that it is having a spasmodic nature of action. So, contrary to the popular belief that ipecac may not be helpful in cases where there is a spasm or acute pain, and we think of Macphos or some other remedy, colocynth, or maybe we can think of some antispasmodic remedy, but Ipecac is one of the antispasmodic remedies if you know how to think about it and prescribe it. Now, when you should think of Ipecac as a spasmodic remedy, I will share that in some few minutes. But one of the interesting things of Ipecac is that it has nausea which accompanies all the complaints. You can say that nausea with clean tongue, which is peculiar, which we learn in college, which we learn in our clinics, but nausea will be there with the moist tongue also, with the salivation also, and there will be profuse secretions. So in Boger, when you go and you read Boger, the first line, the very first line which is written is profuse secretions, and there is foamy discharges. So by the first line, first few words itself, you will understand the remedy has a very, 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 very profound action on the secretions, and that is where you should think of ipecac. Now you will say that it's a summer season, and where do we think of this ipecac as a remedy, and what will be the indication in Kent? When you will go and you will go in the respiration chapter, you will see that it is one of the remedies mentioned for respiration difficult with change of weather. So there will be a change of weather very soon in India when there will be monsoon, and people will start having some issues with their respiration, with their uh, you know with their gastric troubles, or they'll just have a bout of cold or a bit of cough, and it's a initial phase which you'll be seeing. You can think of ipecac because it is one of the remedies mentioned for respiration difficult change of weather, and also one of the another rubric which I'll be coming very shortly. If you have a patient who is immediately affected with difficulty of respiration as soon as he takes the cold, he will require ipecac, because uh, ipecac is one of the remedies mentioned in Kent for respiration difficult, along with cold after immediately after taking cold. Now, another thing what we see in ipecac is that many patients will land in your clinic and they will tell you that this is what happens to me every summer. Last year also it happened, this year also it happened, and I don't know why is it happening again and again. One of the top remedies for periodicity, and especially yearly periodicity, is ipecac. And when you have a patient who says that exactly in the last same season, it may not be the accurate date, it may not be the accurate time or month, but it will be this season which has the patients have the trouble. Think of ipecac as one of the top remedies, especially in summer. It is one of the only remedies mentioned in Complete Repertory 2024. So I see a few people joining: Dr. Parul Srivastav, Dr. Megha, Dr. Pia Soni, Dr. CP Maurya, Dr. Vinita Pathak, and there are a few queries from a few people. So I'll address those queries once we move further. So stay tuned. And in YouTube also we are live simultaneously, where there are a few people and watching, and you can see there in the PowerPoint as well, if you are able to join in there, if you want to see it there. So now going further, after you see that it is one of the top remedies for periodicity, and especially periodicity in summer, ipecac should be thought. It is one of the remedies you should think. I already conveyed you about nausea with clean tongue, with salivation, and they'll feel that they want to vomit. They will even vomit, but even after vomiting they will not feel better. So you have a picture, some traces of nux vomica which are present in this remedy, and you should think of ipecac. Yes. So Dr. Parul, you're asking, is seasonal medicine useful? Yes, so I will try to understand your question very soon. Maybe you have not typed it well, or you typed in a hurry. So you can just frame it well and you can tell me. Now, when we go and read Tyler, we see that she has mentioned that the young doctors make good prescriptions, especially of those times where they used to read Materia Medica all the time, and that is what we should do incessantly to master our art and science. We should keep on reading the Materia Medica continuously. Apart from reading Materia Medica, when we go back to the provings, we find something interesting. And for ipecac, we see that ipecac develops the symptoms. First, it will develop the symptoms of the gastric sphere, then the respiratory sphere, then the spinal sphere, then the genitourinary, then the cutaneous. So, in all the provings, if you go and read, you will see that ipecac has affected first the gastric sphere, then the respiratory sphere, then the spinal sphere, then the genitourinary, then the cutaneous. So if you have a case who is predominantly showing you signs and symptoms of gastric sphere affections or respiratory sphere affections, think of ipecac, because that the immediate relief that it is going to give with frequent repetition, because it is a short acting medicine, you will be more than happy. So also the patient will be more than happy. So I see a question from Dr. Parul, and you say that medicine which you want to know in this season. So I would like to reaffirm and reconfirm that if you go back to my profile in Instagram, or if you are on YouTube, you can see the live was done in the last month, where I discussed about Kali bichromicum, antim crude, and sinapis nigram. You can go through the video and try to find out what are the indications for those medicines. And today I will be discussing about ipecac, colocin, and sulfur, when and how you should prescribe and why you should prescribe. And again, the same thing I'll be doing in the next week at the same time. So I'll be announcing on my profile. So in this way, coming back to the topic for provings, you see that ipecac is indicated in cases where you have predominantly gastric and respiratory symptoms and less of spinal, genitourinary and cutaneous symptoms. Now, I would like to share a case from my own experience, and I was in village, just last week, and I usually carry a group of medicines with me, like all the common remedies: arsenic, podophyllum, protontic, aloes, sulfur, and ipecac and bryonia, and all these common remedies that we should think of. So there was a child who was crying day and night, and just they had come from Mumbai also like me, and they were very much bothered because the child couldn't tolerate the hot atmosphere. There was a sudden change of weather, and the parent used to keep on going to and fro with the child. There was a need for being carried in the child, and he felt better, but he started crying after few minutes of that episode of the parents walk, and yet he was not being able to be calmed down. So naturally, anyone would think of chamomilla. And also, I saw that there was one interesting symptom, which was, he used to be given something by other members in the house so that he's quietened, some toy or some, fluffy object like the teddy bears or something. And for a moment, he used to stay silent. He used to throw it away, and then he used to, get angry again and keep on crying, crying, crying. And this went on for around 6 to 8 hours and 12 hours, the entire night and the next morning and till the next afternoon. And since I was also there, I was watching the child, and I was able to understand what's happening. So I just that day I gave him chamomilla, and I gave him chamomilla. I had 200 potency. I gave him chamomilla every 1 hourly, and still there was no feeling of betterment in the child. So naturally, one would think that how and why do you fail in such cases? Normally, whenever I travel, I do have the apps to refer whatever book I need to refer. I do carry a few books like Boric and Bogar are always there in my bag. So if you are a true homeopath, you know the importance of these small books, and they are very small in nature. They just need to be put in the bag, and you can read it anywhere, and you have the apps also, but the apps will give divert you in a way, because there are many things happening in the mobile, and in the book you have the focus. So I just opened Boric repertory, and interestingly, in Boric there were few rubrics I took. Carrot desire for, you see, there are just few remedies in that, 5 or 8 remedies. Then there is irritability in the mind, where child wants something but he throws away at another time. Then there is mind. In mind you see impatience, and then in the next rubric you see boric mein mind irritable day and night. And the first remedy which comes is chamomilla. The second remedy which comes is ipecac, which covers all the four rubrics, namely carrot desire to be irritability in the child. When given something, he holds on to it and he throws it, and he you know can't be quietened. He wants to be carried. That is also there, and he's impatient, he's impulsive, and he is irritable day and night. So without any laptop application or mobile application, even if you refer the books, these are the small books. And I have had a workshop on the boric repertory in the month of February. The recordings are available. Those who want, they can definitely avail it. It's a very short repertory, and it will help you in quick prescriptions like this. And the case which I had at my hand in the village, ipecac was given to the child, and every 30 minutes I gave, and within 7 doses, like in 3 or 3.5 hours, by the next evening, After chamomilla was given, he was not better. I gave him ipecac. With ipecac, he improved. Fortunately, I had 1M potency, so I gave him 1M potency every 30 minutes. हर 30 मिनट पे देने पे इपिकैक से within within 7 to 8 doses he felt better. So where you have a picture of chamomilla and you are thinking of giving chamomilla, or you have given chamomilla and still the patient is not better, think of ipecac, and you will, hopefully you will succeed in the most success better way. Interestingly, there is a rubric also in boric repertory which says that extremes of temperature aggravate. So if there is extreme hot or extreme cold, you know that there is ipecac in the rubric along with antemtart and lachesis. So if you open your books, read these things, you will be able to achieve and master the patients in your clinic, and maybe give quicker results than any other method available at your disposal. Interestingly, Nash Therapeutics, if you have known this author or if you will be reading this author, you will see that he has mentioned that Nash says that ipecac should be given only in two conditions which should be there in the case. The first condition is that excessive accumulation of mucus. Okay. And second thing is that there is spasm. So if you have a patient who is able, who is who has come to you with a respiratory distress, and he told that the child started having some respiratory distress or light bout of cough just few hours ago, there is a lot of nasal secretions and we are unable to find out whether he is able to bring it out or not. And on auscultation, you find that he is having a kind of a congestion which is going to begin. Think of ipecac. It is a phase where the patient refers to you in the initial aspect, like especially in the first few hours or first day itself, and has not progressed to the weakness and sleepiness of antemtart. So you know your pace of disease, you know your day of appearance of patient, and you know what and when it is that this symptom has appeared, and you prescribe ipecac, maybe in frequent repetition, and it will avoid an entire attack of whatever respiratory trouble that will come up. So very soon in India, you will be having monsoon season. Some parts of India like South India or West Bengal and certain areas already have the onset of monsoon, or some uh, areas where there is a kind of cloudiness or thunderstorms or light rains that have started. Think of ipecac because it is one of the remedies which can be indicated in change of weather, and where there is spasm and there is accumulation of mucus, think of ipecac. The next remedy which I come to in summer season is colocynth. Now, if you open Boric, you will see one of the interesting lines, exactly first sentence which is mentioned, and that is often indicated in the transition season where the air is cold but the sun is powerful enough to heat the blood. So very soon in Mumbai, where I'm located, and in other parts of the country, you will have a transition season. There will be cold nights and hot days. Think of colocynth. I remember a very interesting case from last year. It was midsummer, and the patient had come to me with 8 to 10 episodes of stools. There were sudden cramps. And he told me that after eating or drinking, suddenly he has to pass the stools. The first remedy that you should think of is Elos, Croton-Tig, Colocynth. I gave him Croton-Tig because immediately after eating or drinking, he had to pass the stools. Unfortunately, he didn't improve after 6 hours, and he told me that there is lot of cramps in the calf since the time I started having stools. So you see that this is an extension of complaints, and when there is this extension of complaints from the gastric to the calf region, it was not that the cramps in the calf started after the stools, which normally happens, but it started with the stools that he was passing with the first episode itself, you should think of colosynth. I gave him colosynth 1 m every half hourly, and in 4 to 8 doses, 4 to 6 doses, he felt better by 8 p.m. in the evening. So, you should be able to act speedily, you should be able to act fast, where you think that this patient may not improve so well on my medicine, or where you are not feeling confident. You should think of high potency, you should think of frequent repetition, you should know what are the key indications. In colosynth, there is extension of complaints from the seat of action, which is the gastric region, to the other parts of the body like dioscoria, but here it will be more of nervous origin, and some things that I'll be covering very soon. So when you open Fatak also, you will see that there is sudden atrocious pains and crampings, which make the patient twist and turn, and the patient presses to feel better in his pain. And as soon as he goes to bend his abdomen, he feels better, and there is profuse urination along with that, and also the patient vomits. Now, if you see this picture, what is mentioned in Fatak in the first few lines, 4 lines, you will see that it is what exactly happens in renal colic. And if you want to achieve that success in renal colic, start with colosynth or berberis. There was a workshop which I did, renal calculi management, which is available as a recording for those who wish to watch. You can avail the recordings, and you should understand when the complaints happen, what are the symptoms before, what are the symptoms during, what are the symptoms after. How to differentiate different remedies, sarsaparilla, lyco, colosynth, parera brava, ua ursi, all these remedies, hydrangea, etc., hidioma, osimum canum. So colosynth can be indicated when there is summer season, the patient has intense colic, there is extension of pain from one part to the other part, and if you go to the provings and you find out what is there in the provings, after every prover took the medicine, there was just nothing that happened. For the first few hours, there will be medicines like ipecac, the remedy I discussed already earlier. There will be medicines like ipecac which were taken by provers, and immediately within fraction of seconds the complaints started. The patients had spasms or bouts of cough or respiratory distress or pain in abdomen. But in colosynth, there was not that something that happened immediately, but that something happened after 1 or 2 days, and the symptoms appeared in groups. So if you have pain in abdomen, along with that there will be urinary complaints, along with that there will be headache, along with that there will be kind of a pain in the chest, or kind of pain in the legs, nervous system affections, and uh, pains will be followed by profuse urination. That is one of the key indications where you will think of colosynth. And in one of the provers, there was also anal hemorrhage, which went on for 1 year, even after he stopped the medicine 1 month after the proving. So, in cases where there is ulcerative colitis, think of colosynth as a intercurrent remedy along with your constitutional. It is going to help the patient a lot, and especially in such seasons, this transition season or summer season, complaints of ulcerative colitis or gastric mucosa may increase, and you can think of colosynth as one of the top remedies. So, going further, when you see Boger synoptic key, it mentions 4 5 locations for seat of affection of colosynth. What is that? First is nerves, which is trifacial nerves. Second is abdominal nerves. Third is spinal nerves. Fourth is sciatic nerves. Fifth is digestive tract. So you see that pain affects the organs, but it affects more to the nerves than the organs. And there is extension of pains from one part to the other part, and there is a numbness which follows after the pains or urination after the pains. How will you differentiate colocynth from other remedies? One of the things is that in Elos, Bryonia, China, Colchicum, and Stannum, when you go to examine these patients, you will see that even if you just start to palpate their abdomen, they will say that it's very much painful. On the contrary, remedies like colocin, nux vomica, and macphos will give a sigh of relief when you press the abdomen, and that sigh of relief will, indicate those remedies right then and there. So maybe the symptoms may or may not be pointing to the remedy colocin, but if you check the patient, if you examine the patient, and you find that there is kind of a, better by checking the patient or pressing the part or abdomen, colocynth should be given. Now you have been seeing patients in the month of summer, and you have patients who are coming to you with cold intake, and there is a lot of gastric distress. One of the remedies you should think of in such cases should be colocin. It is present in the rubric of Kent, rubric mentioned by Kent. Abdomen pain, aching, dull pain, drinking after overeated or when overeated. So when the patient is out in the sun for 2 to 3 hours or 1 hour, and immediately after that he has drank cold water, colocin should be one of the remedies which should be thought of. Apart from arsenic, apart from Belisper, apart from Bryonia. So I had taken a live session last few days ago where I took about 30 to 45 minutes for ailments from cold intake in summer, and there were a few remedies which I discussed, and it was a very nice interactive session where people were there in the session. So colocin should also be one of the remedies which you should think of in pain in the abdomen when the person is overeated and he drinks cold water. Another interesting symptom which colocin usually covers, especially in the gastric sphere, is that before uh, before the meals, dinner or foods, there will be not any pain, not any complaints. He'll feel better. He'll have good hunger. But immediately after food, after eating, maybe it is light snacks, breakfast, lunch, or dinner, there will be pain in the abdomen or heaviness like feeling, and he'll have to rush to the to pass the stools, or it may be of you know watery nature. Think of colocin in such cases, especially also where there is hypogastric pain after the stool. You can think of colocin. So this was the second remedy which we covered. So Dr. Nikhil, you want to watch the renal calculi recorded video? You can drop a WhatsApp message to the number mentioned on my profile, and we'll get back to you. Or you can send a DM direct message to us so that we can provide you the recordings. The third remedy. So I discussed about Ipecac. I discussed about colocin. Those who are late to watch, they can watch the recording again. It will be put for certain number of hours. The third remedy, which is very important and should be thought of in summer season, is sulfur. Now, interestingly, sulfur is a remedy which many people would think how to give it in acute and why to give it in acute. If you read boric materia medica, you will not find anything interesting, but if you read boric repertory, you will find that there is a rubric which says complaints improve and then they remain stationary. Three remedies are mentioned, out of which one of the remedies is sulfur. If you have a case where you have given maybe Picac, maybe Bryonia, maybe any acute medicine, and still the complaints are persisting, and you know that this should go, maybe a day or two may require of the same medicine. But if you want to clear it up soon and prevent the recurrence, think of sulfur. It is the best finisher. We all love finishers. We all love good finishers. It's the time of IPL, and We want good finishes by all the favorite teams that we are watching. Sulfur is that finisher that you will be, you know, that it will give you the experience of a good finish of a case and prevent a relapse. In fact, there is a rubric in Boric repertory which says complaints improve and then relapse continually. So you'll have a patient which will tell you that I felt better with your medicine, and you are thinking that maybe I should give a different medicine to the patient. Give sulfur and give the same medicine. Maybe the patient will be more than satisfied, more than happy with you, rather than changing the medicine and doing a zigzag cure. Boric also mentions sulfur as one of the remedies for passive inflammations. Now there is a case which came to me last year, or I think couple of years back, and the child had lot of eruptions in the this part, exactly the neck region, and the mother told me that exactly 1 year ago same thing happened, and now in summer again this has happened. And I'm sure that everyone will experience this in your clinic. You will have patients who will be coming to you with lot of eruptions on the forehead or on the neck, or certain parts of the bodies where it's lot of eruptions in small spot, and they are fiery red. If you go to Kent repertory, you will see that there is a rubric, eruptions vesicular confluent. This rubric has only 5 remedies. Sulfur is one of the top remedies in it. And if you see another rubric from another repertory, which Boric, which says aggravation periodically every year, sulfur is another remedy. So I gave this child sulfur every 1 hourly, 30 potency. Within 2 days, the eruptions clear. So if you want to employ sulfur in the right way, especially in skin diseases, I have chosen the lowest potency. Maybe in some cases where there is gastric trouble or some other complaint, where you need to give a good finish to the patient, you can think of medium to high potency. Another interesting aspect where you should think of sulfur is irregular distribution of heat. So if you go in the repertory, you go to the different materia medicas, you study, you see that there is only remedy sulfur which is mentioned for hot palms or hot soles or hot vertex. So there is a kind of an irregular distribution of heat. Sulfur should be one of the remedies. In summer season, you'll have patients who will tell that there is a lot of heat feeling, but I cannot explain where it is, but you can check. I can feel there is a lot of heat in my head, or there is a lot of heat in my palms or in the soles. Think of sulfur. In fact, in cases where there is chronicity of this complaint, sulfur can serve as an intercurrent and help clear the issue. But if today's session deals with more of acute scenarios for employing sulfur, and especially in cases where you will have, uh, you know, accumulation of eruptions in one spot in children or adults in summer season, think of sulfur. And also sulfur for yearly recurrence of complaints, and complaints where patients where you have given some uh, you know remedy which is not improving, and then there is a stagnancy. You can think of sulfur as the good finisher for your cases. So let me see. There are some questions on YouTube as well. We are live on YouTube also. Meanwhile, if any of you would like to ask, especially those who are on Instagram, if you would like to ask any questions, please feel free so that I can understand what are your needs and what are your queries. And we'll be doing these sessions more periodically and more often from the month of June, so that you can get the best advantage of it. Uh, so there are few questions on YouTube, and let me just go through that. Meanwhile, if anyone would like to also uh, undertake the recordings of our past sessions, you can definitely contact me or the WhatsApp number which is mentioned. There are workshops which I have done on case taking and the rubric workshop and also kingdom differentiation workshop where you can differentiate plants, minerals, and animals. And many more workshops are planned. If you are part of my workshops, you get discounts. You can avail the recordings. Renal calculi management was one such workshop. And upcoming workshops will be understanding cough, mastering fevers in the month of June, July. Stay tuned. Dr. Vaishali, you are asking for remedies for ringworm. I think there is, it's a big topic itself, and I have collected a few cases from my own clinic. I'll be glad to take this session maybe anytime in future, so stay tuned. But as of now, I would say that sulfur can serve as one of the remedies. Mug salt is one of the remedies. There can be basilinum which you can give as an intercurrent, and of course ringworm 1 m as an intercurrent in such cases every 4 to 5 months, 4 to 5 days can help such patients improve well. Dr. Ishwarya says on YouTube, cold nights, warm days, Dalkamara is also important remedy. You are right, very nice. But that is one of the remedies which I'll be taking up in the month of June, where the whole country, especially India, will be enveloped in monsoon season. And what should be the indication for Dalkamara, we can think. Dr. Mohammed Yasin, throw light on nasal polyps and remedies of your experience. One of the top remedies for nasal polyps is Tucrum marum verum. I had a case of Tucrum marum verum where the polyp was as big as the entire nose and it was there on the left side. The other remedies that you can think of in nasal polyps should be Calcarea carb. In fact, in Clark, you see Clark, the prescriber. Calcarea carb 6 or 30 is mentioned, which is given with frequent repetition, and that helps the patients. And there are many other remedies for polypus also, like you can think of sinapis as one of the remedies, and also phosphorus was one of the cases where I indicated. Uh, I think you should see the sensitivity of the case. Most of the Tucrum marum patients, what is the question from Dr. Meenakshi is that which potency of Tucrum marum should be given. So my answer is that you should think of high potency, because most of these patients who come to you have already high sensitivity. They have already taken a lot of medicines, oversensitiveness to medications, lot of allopathy taken should be your first indication for Tucrum marum. And if you start high, you will get some sensitivity which is calmed down, and you can go for your medicine then afterwards. When you all go for constitutional prescription and when you will choose for keynote prescription, Dr. Nikhil? So very nice question. This is a very big topic to discuss itself, but there will be cases where you will not be able to find out uh, some peculiar symptom except one symptom. Okay, all the other symptoms are common in the case. So in those cases you can think of keynote prescription. In cases where the entire constitution is disturbed, physical generals are disturbed, the mind is disturbed, there is a pattern of disturbance that is happening to the patient. He is distressed at his work, he is distressed at his in his family, he is distressed by the events in his life. So you can see that everything around him has stirred up the emotions and disturbed him as a whole. Think of constitutional prescription. Keynote prescription should be thought where everything is normal, the patient is not disturbed at all, whatsoever is happening around him. It can be a psychotic case also, but you see that there is one important symptom in the case, and that guides you to that keynote prescription for that medicine. It can also happen that there will be one-sided cases where they will not be able to share anything more than what is happening in that part. So think of small remedies in those cases. So, anyways, we take a break right now, and if you wish to avail any of the recordings for our past workshops, case taking, rubric workshop, kingdom differentiation workshop, renal calculi management, you can view the excerpts which are posted on my timeline already, and you will get to know what we have covered in those sessions. There are many more interesting things coming up very soon, so stay tuned and. Goodbye for now. Those who are joining late, you can go through the recordings once again to see what remedies we covered today. We covered ipecac, colocynth, and sulfur. And in the last summer remedy seasons, we covered calibicromicum, antimcrude, and sinapis nigra. So that's all for the moment, and thank you all for joining.